All right. So thank you guys for coming. And I'm actually going to hand it over to Natalie for a second.
Hello, everyone. I'm Dr. Natalie Oldenstall, and I'll be your moderator for the evening. If you have any questions, please put them in the chat on the side of the window, and we will get to those at the end. If you have other questions after that time, you can email them to us, and we'll do our best to get back to you as well. Dr. Laurie McCauley has a lifelong passion to help as many pets as possible live an optimum quality of life. After graduating from Colorado State School of Veterinary Medicine, she spent 6 years in general practice and quickly became a pioneer in the field of veterinary rehabilitation. She went on to open the first veterinary rehabilitation clinic in 1998 and designed the first underwater treadmill for dogs. Dr. Laurie was on faculty at the Canine Rehabilitation Institute for 14 years and has taught thousands of veterinarians and other rehabilitation professionals the art of canine rehabilitation and sports medicine. She is certified in acupuncture and chiropractic therapy and is board certified, one of only 116 in the world, by the American College of Veterinary Sports Medicine and Rehabilitation. She has been a leading expert in laser therapy for the past 20 years. Dr. Laurie is also an international lecturer and contributing author to multiple veterinary textbooks and journals. She was awarded the 2011 IMS AARV Award of Excellence in the Field of Rehabilitation and the 2015 AHVMA Holistic Practitioner of the Year Award. She regularly steps in as the head of the Integrative Medicine Department at the Louisiana School of Veterinary Medicine. Dr. Laurie also owns Red Tail Rehab, a mobile canine rehabilitation practice in North Carolina. She started her veterinary education platform, Optimum Pet Vitality, in 2022 to teach professionals and pet parents different ways to help their clients and pets achieve optimum health. And without further ado, here's Dr. Laurie.
The reason I'm here is to help you. I want to help you because we see cruciate disease so much. It's one of the most common orthopedic diseases we see. Literally 80% of the orthopedic surgeries right now are cruciate disease. If you're in a rehab practice, you're more than likely to see a dog or cat with a cruciate injury daily. If you're in a general practice, the practice probably sees one at least weekly. I want to help you optimize healing, improve client compliance. So when the client sees their dog get better, they're more willing to do things at home, and we can help them help their pets and increase revenue in your practice, because there's so many veterinarians that have purchased a laser or another piece of equipment and they don't see the results that they expected or they want. And so it sits in the corner. And I don't want that. I want you guys to have those wow, aha moments. I can't tell you guys how many times I've had clients say, Doc, if I get on the ground and like bark like a dog, will you treat me too? It's just, I want, or people will say, how much do one of those things cost? Can I purchase one? I want you to use it to the best of its ability so that all of your patients get significantly better. I have had a ton of people ask me which laser to use. Or they have one and they're like, okay, well, I'm not getting the results I want with this one. If I had a different one, would that make a difference? So I want to go through this with you and help you so much with cranial cruciate disease. The 3 secrets I'm going to go over with you tonight are how to learn to potentially prevent cranial cruciate rupture, understanding everything, then learn how to treat the supporting structures so that we again help support the cruciate so it's less likely to have a problem, or if it has a, it heals faster, and learn where to find the hidden areas that I have found that make a huge difference in the outcomes of my patients. I wanted to start by talking about CCL disease in general. 30 years ago, when I started veterinary medicine, cranial cruciate, I was in a 6-doctor practice and we saw one with everybody per month. And it was a trauma. The dog jumped up to catch a frisbee, they landed wrong, and bam, they had a cruciate injury. Nowadays, the same practice sees several a week. It is literally 80% of orthopedic surgeries that are done right now are cranial cruciate ligament surgeries. And from the research, 30 to 50% of the dogs, or now cats and other animals that we're seeing that tear one, within 2 years will tear the other one. And it's like $5 grand. plus or minus, depending upon the surgery and the surgeon. A lot of people can't afford it. And I can't tell you how many times I've had clients say to me, Doc, this person told me that if I can't afford this, I have to put my dog down. No, 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 no. Never, never, never. Please don't ever think that. Even if you do nothing, in 6 months, that cruciate will be, that knee will be stable, right? Super, super important. Uh, yes, they're going to have arthritis. Yep. And they're probably going to need some NSAIDs or some pain meds, but they can have a life. Um, but I want to help prevent that. So let's talk about what's happening now, because it's not a trauma injury. It is a degeneration process. What happens is we get inflammation. So the cells on the inside of the joint capsule produce inflammatory mediators. Those inflammatory mediators, we get some inflammation in there. Our aggregans, right? So here's our chondroitin and keratin and all our parts of our cartilage, our hyaluronin. All these things start to break down. Right? 80% of cartilage is matrix, 20% is cells. And that matrix gets smaller and smaller. And then the chondrocytes actually start to produce their own inflammatory mediators. And our structures get smaller and smaller. And it's this cycle, and we need to break the cycle. First thing to need to know is that the CCL is in the joint, right? So when we look inside the joint, we are actually seeing these torn fibers, right? So they're affected by the environment around them. These inflammatory mediators come in and they cause this problem, and then pop, pop, right? These fibers start to tear, and they tear and they tear and they tear. And then you may see a partial tear or poof, right? You get a full tear. So it's not just the cartilage that's affected. The ligament itself, we can treat these. We can treat all of this. So our goals, right? Anybody ask me, how do I do? My first thing is, well, what's your goal? I want to know the warning signs. I want to be able to control the inflammation. I want to improve the health and strength and blood flow to all the supporting structures and treat all of the available cartilage. And you're going to go, oh, well, I just go over, I do my points, I do my scanning. Oh my gosh, no matter, depending upon how you move and where you put your probe, you can get much better results. So I'm going to go through the early warning signs first before we even get to the first secret, because I can't help myself. I want to teach you guys so much. So the inflammation, we may not know why it's inflamed, right? Then we may or may not get effusion. Believe it or not, most of my clients can palpate effusion because I want them to, so that if we feel it at all, they are going to be able to say, hey, Laurie, I've got this issue. But I'm going to give you even more important things. We're going to go through pain on draw or thrust, changes in posture. I'm going to show you radiographs so you know what to look for. And then we get to secret one. So inflammation to effusion. The CCL doesn't just tear from trauma, right? We get the inflammation. If you put your fingers, right? So here's my patella. Here's my joint capsule. I come just below the patella. Here's my patella ligament. I should have a indent, right? Concavity on both sides. If I don't have concavity on both sides, if I can move my fingers back and forth, there is inflammation in that joint. We need to be treating it, right? However you're going to treat it, there is inflammation, and that's immediately increasing the chance of cruciate damage and eventual cruciate tearing or rupturing. So we need to check for that. If you're doing it, start lasering. Don't wait until we have a major problem. And what's really cool is most of the time you have the clients feel it. Hey, can you feel this? It's not totally concave. See how I can move this fluid? We laser it, and then they feel it again. They go, wow, that's the difference. And that's when they say things like, hey, how expensive are these machines? Discomfort with either drawer or thrust. You may only have a few fibers torn, or you can have the whole thing torn, right? But a lot of times we'll have discomfort. It doesn't have to be the dog screaming and trying to bite you. If they're like, hey, by the second or third time you do it, there's something going on in there. And we need to start treatment early. We need to be working with them early. Okay, we can see their weight pulled forward, right? How many times do we see this with the dog? Their knees are straight, their limbs, their front limbs should be under them. If they're back at all, that means they're trying to get weight off of their back legs. Now, that doesn't necessarily mean it's a cruciate disease. It means something in the back hurts and they're shifting their weight, but it's something to look for. And it's something we can teach our clients to look for. An even easier one is if we have our pelvis higher than our withers. Now, there's going to be some breeds that are just built that way, right? But if it's a breed that's supposed to have a flat top line, and now all of a sudden the withers are lower than the pelvis, we're going to have secondary back problems. And we need to see, are they standing super straight? Why? Because dogs stand even straighter in the stifle if they have knee pain. They're trying to get off it. They're trying to get a different place that's connecting and their pressure is going through. So that's an easy one to look for. We all know the puppy sits, right? Why does a dog sit like this? Let's go back for 1 second. If we have cruciate injury, oh, actually, hold on. Let's go to here, right? What do? We say, let's have here's the patella, here's the tibial crust. If I flex the tarsus and the tibial crust comes forward, I say, okay, we have cranial tibial thrust. I have a compromised cruciate ligament. It's the flexing of the tarsus that's pushing that tibia forward, right? Now, let's fast forward to these guys. What are they not doing? They are not flexing their tarsus, right? They are not putting themselves in a position for that tibia to come forward and cause discomfort. Now, if you have a 3-month-old puppy, a 4-month-old, that's fine, right? As long as they're switching sides. But if they're an adult or 6 months or older, they should be sitting like this with total flexion. I can't tell you, is it that they sit like this and when they go to get up, they're putting abnormal stress on their knees, so they're more likely to tear their cruciate? But I have found from a lot of years doing this, the dogs that sit with that puppies sit, not only are they going to tear their cruciate, much more likely to tear their cruciate, but the side that sits out most of the time is the one they're going to tear. All right, let's look at x-rays. This is a beautiful stifle, right? I have a nice clean patella. My fabellae are beautiful, nice even edges. The top of my tibia looks great, right? I have a nice big fat pad. That's this dark area in here. Wonderful. All right, let's look at a not so normal one comparatively, right? Now I'm starting to have changes on my patella. My fat pad is pushed forward. So all of this is fluid, right? It's pushing it forward. That one's not so bad. It's having issues. Oh, actually, you can see the effusion back here, right? Let's go forward more. Here's some mild, right? So I have fluid being pushed in, decreasing the size of my fat pad. We go up to moderate. Now I have more fluid coming in. And I have a little bit of changes right here in my patella. Then when I come over here, this is severe, right? My fat pad is tiny and I have a large osteophyte on the patella. Look at my fabellae, right? They're not even. I have osteophytes on them. This guy, he's not looking very pretty. So these are the kinds of things we're going to see with effusion, which is going to lead to or be part of the cranial cruciate rupture. And then we see this, right? This is our 3-legged lame dog. You can see weight is off of this. This one is under him, right? So he's pulling his weight forward and his weight's on the diagonal limb. This one's a little bit out, more lateral, a little more forward, so he doesn't have as much weight on that one. This has all of his back end weight. He's got his rear limb internally rotated. He's picking it up. He doesn't want to put weight on it, right? That's our typical comes in. Yeah, you're a torn cruciate. So what's the secret? All right. Way before the lameness. And I see this in working dogs. I see this in pet dogs. I have trick dogs that have these signs that we can find and fix so that they don't tear their cruciate, right? I have literally found this in hundreds and hundreds, if not thousands of dogs. So crepitus, and you're going to say, okay, I'm used to feeling crepitus. I'm going to teach you a way that is probably different than the way you're used to. And I'm going to explain how you can find and affect range of motion. My personal opinion, right, is absolutely every athlete, straight leg dogs, all dogs should be checked. And then, honestly, to me, every dog that has a wellness exam, you should be checking their patellas. So now that we said that, how do we do this? So crepitus. So we're not going to find crepitus unless you have really, 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 really bad disease, between the femur and the tibia, right? Because you have a meniscus right there, right? But where do we not have something that's going to stop that? Between the patella and the trochlear groove, right? So now we're saying, can I grind the caudal patella on the trochlear groove? How do we do that? This is like the most sensitive test. I'm going to show you this video and I'll play it twice. I'm going to put my palm against the patella and do flexion and extension. And then here I am assessing the meniscus, which not going to be a problem in most dogs, but super sensitive is pressure against the patella and then full flexion and full extension. Please ask everybody to mute themselves. Thank you. And you'll feel not in mid-range. At the very end and the very beginning, you'll feel a, and that is cartilage on cartilage. And if that continues to grind, that's what we're talking about, wearing away that cartilage, creating more inflammatory mediators. And you can say, all right, so it's wearing. Can it change? Absolutely. I have, again, had literally hundreds of patients, if not thousands, that we have found this. We have done laser. We have done chondroprotectants. If that's not enough, we can do polyglycosaminoglycans and make it go away, right? It's huge for decreasing the chance of having a cruciate injury. So I will even teach my neon clients how to feel for this, right? My neon clients are my best clients, the ones that I can teach them anything and they get it. They understand dog. My neon clients, I would say 70% of my clients have lasers. So we can make it go away. That's the important thing here. All right. I need to explain to you about changes in patella position. There's 3 different normals. So we have, just like the Goldilocks and the 3 bears, we have one that's too high, one that's too low, and the one that's just right and in the middle. So patella alta is really high. That's the one where you go to motion the patella and it's going to go one way, the other way. And you're going to go, oh my God, is it a luxating patella? But it doesn't pop out. You have the normal one, which when you're going to motion, and we're going to talk about that in a second, is going to move. And then you have patella baja, right? And he's down low. It doesn't matter what you do. He is just not moving in the trochlear groove because he's just so low, right? His patella tendon is just so short. And it is normal for him. And it's not just breed dependent, it's dog dependent. So I'm going to talk to you guys about normal and patella alta dogs. You may not be able to do this. You won't be able to do this with patella baja dogs. But you have to understand what's going on. All right. So you have to have the stifle in full extension. Let's go back for a second, right? When we have it in full extension, the patella is going to ride high. We're going to assess for lost patellar motion. We want to be able to, so if this is the patella, quadriceps are up here, patella tendons down here, we are going to want to be able to move it left to right and in both diagonals, right? Those are the 3 motions we want. Now, those of you guys who know me, I always make you do it to yourself. So wherever you are, if you're sitting down, if you're not sitting down, sit down. I want you to sit at the end of your chair. I want you to straighten your leg, right? So your heel is on the ground and your quads are totally relaxed. And then I want you to grab your patella and move it left to right and in both diagonals. And if you're a soccer player or you've been an athlete or you've had knee issues, it may not move very easily. or at all, right? Humans can have patella baja as well, or you have scar tissue there. And I'm going to tell you in a second why that's important. So everybody, I know you guys are listening to me. So sit at the end of your chair, straight leg, heel on the ground, grab your patella. And if one's like, it doesn't really move much, or it only moves in one direction, try the other side. You got two of them. Try your friend or your spouse, right? So that you can see what normal is, how much motion there should be. Is then we're going to go to the dog, right? So what does it look like on the dog? We're going to grab the patella. So here's my tibial crest. I bend the knee. I have both bumps, tibial crest and patella. See how I can move this left to right? I can move it in that diagonal, and I can move it in that diagonal. And if you go, wow, Laurie, this is really weird. It didn't move. And then I kept pushing, small oscillations. You're not pushing, you're not creating pain. Nothing I teach you should ever hurt. You move that around, and all of a sudden it's moving more. Why? Because there's scar tissue there. What's stopping it is scar tissue. And what does scar tissue do? It contracts, right? It contracts and pulls that patella whichever way the scar tissue is. We want to break down those adhesions. Again, I will teach my neon clients how to break up these adhesions so that patella can lay in the groove and not rub, right? When the patella is pulled to the medial or lateral side, what's going to happen is every time it goes through that groove, it's going to cause inflammation, and then you're going to have the grinding, and you're going to have more and more inflammation. It's just that big cycle until we tear the cruciate, right? And we're creating osteoarthritis, right? It's one of the things that we can work to decrease and prevent in these guys. So even if you don't have a dog in front of you right now, we're going to send you the recording. I'm going to have to take a little bit of it out, but we're going to send you the recording. Play with it on our dog. I'm going to show you the video again so you can see, right? 2 bumps. There's my patella. There's my tibial crest. So I would feel for effusion in the middle. And then right here, I can grab my patella. Feels like a jelly bean. And I can move it left to right, and then in both diagonals. Left to right, and in both diagonals. All right. So what we need to think about is we want to free up that scar tissue so that we can then laser into the joint capsule. We can laser the joint capsule, and we can laser into the trochlear groove, right? So we're going to free up the motion of the patella. In humans, it's a huge problem. A lot of the athletes will actually have to do strengthening of the vastus medialis or the vastus lateralis so that their patella can track straight, so they don't have these problems with their knees. Secret 2, right? Aiming for the support tissue, helping our support structures. We want to decrease the shear force, right? We want to aim for the joint capsule. Super, super important. Joint capsule is where the inflammatory mediators are. We can aim for the CCL directly, right? We can treat it directly. It is wonderful. And then we're going to aim for the cartilage. That's secret number 3, but that's okay. The position of the dog and the position of the laser is huge in that. Huge. So let's talk about the helpers. Let's start with, what does the cruciate do? The cruciate stops the tibia from coming forward, right? That's why when we do drawer, when we try to push it forward, if it moves, it means the cruciate doesn't work. When we flex the tarsus, if the tibia comes forward, it tells us our cruciate's not working. It also helps with rotation, right? So those are the things we have in our head that we can say, how do we help this guy? Well, if we help the muscles that stabilize and prevent shear force, we are helping to protect this cruciate. So our quadriceps and sartorius, so the front of the thigh, right? So here's my hip, here's my knee, there's my little patella. Blue is the gastrocnemius, so the back of the calf, the quadriceps in the front of the thigh, coming down over the patella and the patella tendon. We want to laser those to help decrease shear force. When we laser, we're actually increasing calcium motion in and out of the muscle cells, which means that our muscles can contract easier and they can relax easier, right? Because if our muscles are staying really tight, they're not going to get stronger. The only way they get stronger is to stretch and contract, right? That's what exercise is. The laser also decreases oxidative stress. So we can actually allow that muscle to work longer without having any problems. What's really cool is there's studies that show that it can improve the rate of strengthening and improve muscle endurance. What's really wild is with laser, we can have different effects in the muscle depending upon if we do it before or after, right? So we have to figure out what's our goal. Is it strengthening or is it endurance? And then we're going to treat appropriately. Why do we need to do it? Because our dogs do these kinds of things. Now, look how nicely muscled this dog is, right? I look at that and I drool. I'm like, oh my God, that's beautiful. And it takes time, right? We know before we have changes in a muscle, when we're doing exercises, it takes 3 to 4 weeks to have physiologic changes. At 3 to 4 months, we're going to have changes in the tendons and ligaments. So, what does that mean? Really, really important. If you don't exercise at all, your tendons and ligaments atrophy. If we exercise our dogs, we can increase the strength and hypertrophy of our tendons and ligaments as well as our muscles. It just takes longer. All right, treating the joint capsule. This is a study that was done looking at low-level laser therapy, and they found that if you don't treat the joint capsule, there was no difference between the laser group and the placebo group. And they found that when you did treat the joint capsule, there was a significant difference in visual analog scale for pain, human study, the global health status, right? So it's really important to treat the joint capsule, and it makes total sense. When we treat the joint capsule, we are effectively treating the cells that create the inflammatory mediators. We can literally decrease while we're doing it the inflammation, and we can decrease the inflammatory mediators that are being produced that are going to go in and damage the cartilage and the ligaments. There's a lot of studies that look at laser therapy decreasing prostaglandin G2 and COX2. It's a COX2 inhibitor. In this study, they looked at doses between 0.4 and 19 joules. Right. So even at low doses, we can decrease the inflammation, slow the whole process down, or stop it in its tracks. I can't tell you how many times I have had the clients who go, wow, right? I mean, this is like, holy cow, you're not lying to me. Like, of course I'm not lying to you. This is what I do for a living. I've been doing it a long time, right? They're like, oh my gosh, the effusion is gone. Oh my gosh, the swelling is gone. Oh my gosh, my dog came in and now they're putting a lot more weight on their leg. The pain is significantly decreased or gone. I am not telling you that we're going to get rid of all of the pitting edema with one laser treatment. Not going to happen. But can we decrease it? Absolutely. I love to be able to wow my clients. It's one of the reasons I do what I do. It's so heartwarming. All right, let's talk about treating the cranial cruciate directly. I want you to look at these x-rays. These little white bars are exactly the same size, which means if I laser, and I'm trying to aim through my patella tendon into my cruciate ligament, and I'm in extension, and this is my bar, I'm just barely getting there. If I put the stifle in flexion, wow, I almost cut that distance in half. Here's my cruciate right here, right? So I'm getting a lot more energy into my cruciate ligament. He's right here. Here's the patella, here's the patella tendon flapped back, and I can flex the stifle and laser directly into that to get my energy to the cruciate. Big difference, big difference. We can also come from the back, right? So here's the back of our cartilage, the back of our stifle in the patella fossa. Fossa means hole, which means we can stick our laser probe directly in that hole, put pressure on it. We're decreasing the heme, right? Blood. We're decreasing water, plasma. by having ischemic compression, and we're getting closer. We can get right up next to that cruciate ligament. The bigger the dog, a little bit further away, but pretty darn close. We want to have the stifle in a little bit of flexion, not full flexion, but just a little bit. And that allows us to get that probe right in there. And honestly, when I come in here, I do what I call scanning or fanning. I'm going to come in and go up and down and up and down and up and down so that my laser energy, it's in one place. And then the probe energy is treating the whole thing. This is wonderful for a partial tear, right? Because we want to treat that cruciate. It's great before and after surgery. Some surgeons leave these little fibers in there, right? We want to decrease the inflammation that those guys are causing. Some surgeons take those out. It's not going to hurt after surgery to go in there and laser it. It's going to decrease the inflammation and it's going to help protect the caudal cruciate ligament. Not likely to tear, but we're helping out, supporting everything. Okay, so that's a lot of information. I still have one more secret, but I want to tell you there's so little time. There's so much more about cruciate disease and stifles, but I only have a little bit of time. So I have created a race approved for 20 hours, everything you need to know about laser therapy. And I go through things like, hey, let's look at the anatomy and the bones, right? It's up close and personal. And I want to tell you a little bit about it. It goes through all of my trade secrets and my techniques from more than 2 decades of doing this kind of stuff. We have 25 plus short videos, everything you need to know so that you can pick up any single laser and use it to the best of its ability. We have 27, so more than 25 conditions where I go through goals and all of that stuff so that you can watch, say, oh my gosh, I have a dog with a shoulder injury coming in. I can watch this one video and I know how I'm going to use my laser. And I have input from 3 different laser companies about doses and things like that to help you out. So you get all of the videos, you have a full year to watch it. You get, I'm anal retentive. Those of you guys know me, right? I give you everything. I want you to learn this stuff. So you get PDFs of the lecture you can read through. You get a copy of the slides so you can see it. We have a community forum. You can ask questions in there. There's quizzes. Now, of course, we have to have quizzes because of race, but I purposefully wrote them so that they make you think to get the most important information out of the studies or out of the lectures. And there's over 125 references that are like, hey, I am a research nerd. I'm sure there's other people out there that are research nerds. It's right there. You can go through them. So you have all of that right there. So there's part 1, part 2. Part 1 is the everything you need to know. It's me, just like this, right? It's not just voiceovers. It's not little person in a box. I make learning fun. I know I'm simple. And if I'm simple, the only way I can explain it to you is simply so that you can learn it and understand it. We have cool topics like how are they using nanoparticles to treat cancer and laser in sports medicine? How do you get the competitive advantage? There's even information. I found a study on laser and weight loss, right? I think that's really cool. Super important. I have a lecture on how to use laser to stimulate stem cells. In my book, every dog that has any kind of degenerative change, it can be heart, it can be liver, it can be anal glands, it can be arthritis, any of those guys. We can use our laser to increase our circulating stem cells. And there's research that shows that it can do wonderful, wonderful things. So that's in there. Part 2, where we go through what are the disease processes. I help you think through why are we doing this, how to do it. Let's grab a dog and play with them. We've got pictures that I could point to, demos on the bones. Here's a dog. Let's see what are their bony landmarks and the muscle landmarks. How do you hold the probe, right? Where do I aim? It's all in there. You get to see how different machines work, right? Because you may be in one practice, you may be in another practice, you may have different machines in your practice. So you want to have different ideas about the different machines. I want to help you have life-changing effects. So I'm going to read this to you. You can read along with me because it's fun. These are some of the testimonials from some of the people who have taken the course. This is from Dr. Angel Mitchell. We offered the laser course to our entire team of nurses and doctors. It's made a huge difference in our comfort level about using laser therapy. Now our team feels very confident and they're seeing much better results from their treatments. Thank you, Dr. Laurie, for offering the course. It's made a huge difference in in our use and success of laser therapy. Dr. Tran, the video on hips. So I have a great video on hips. I'm going to pat myself on the back for just a second. Right? They're some of the best in an already excellent program. They put what passes the training program when we bought our laser to shame. Thank you for putting this resource together. Their training program was all about how to safely use the laser unit, which they did really well. Your program showed us how to best treat our patients with the current laser information we have. Unfortunately, many of us forget that difference, and we assume that we know how to optimally treat patients because we know how to operate the laser. And lastly, Annie said, we love this course. It was worth every penny. Dr. Laurie thought of everything, everything. She provided us with all that we needed to create an effective, condition-specific protocol, thoughtfully chose our next laser, and train a laser technician who now provides top-notch level care to our clients. We now understand the how and why, and which allows us to fine-tune our treatment plans and get the best results possible. We were even able to standardize the protocols between the different classes of lasers we have in our practice. I had high expectations of this course, and it exceeded every one of them. Thank you, Dr. Laurie, for bringing this beautifully organized body of knowledge to our profession. You are a gem. Thank you, Annie. All right, plus bonus content. If you sign up shortly, this is going to go away. You get a copy of all the anatomy images that we go through that you can print out. I recommend people taking them, printing them, and putting them by the laser so that when you go to laser and you're like, oh, shoot, what muscle was that? It's right there. There's an indications chart, and you go, oh, okay, so it's a list of indications. No, it is an amazing marketing tool because you have that list of indications and you can either put it in each exam room, you can put it so that every appointment you see, you can scan as a doctor, as a tech taking them in, as a receptionist coming in and go, they have ear problems. That's on laser. Oh, they have cystitis. Oh, this dog has lung issues. That the laser can help that. Arthritis, got it. All of it's in there. So you can be primed. Oh yeah, that laser, we can use it for that. Let me have so-and-so come in and treat them. Or let me grab the laser. Watch what's going to happen right now. And then you go, oh, I don't have a laser yet. I'm really worried. It's OSHA. It's an OSHA thing. Do I have to? We give you a template that has everything you need for your records. So if you have paper records, wonderful. You just take the template, put it into your records. If you have computer records, okay, you take the template, you make it yours so that you have all the information you need. It's a great benefit. And these bonuses will go away shortly. So 20 hours of race-approved credits. You've got the bonuses. I highly recommend you sign up tonight. That would be wonderful. I appreciate it. You say, okay, Laurie, but what does it cost? Right? Think about it. If you go to a meeting, a lot of times it's, 300, 800, especially if it's like a certification course, right? It can be $2,000 for a couple day course. This is 20 hours of information. Our regular price for one person, $597. For the next short time, it's going to be $100 off per person, right? For the first year. And if you say, wow, this is a great resource tool, I want to keep it, it's only $99 per year. Tiny little amount of money, right? And then you've got it forever. And then if you say, okay, but Laurie, I want my techs to do this. I want my doctors to do this. Can you give me a little bit more of a break? Yes, I can. I can because I want everybody to do this so we can help more pets. Right? My goal is to help more dogs, pets. Three people normally would be $17.91. We're taking $125 off per person, so it's $14.14. It's a great number. You say, okay, but I got more than that. 5 people, right? Normally $29.85. We're going to take $140 off per person, so $22.85. And you can sign up. You can sign up in the link below. We will be sending you an email that has the link. So overall benefits and why now? My goal. I want you to come with me in my goal and change the world one pet at a time. I want that number, 80% of orthopedic surgeries, to be 40 or 20 or 10 cruciate injuries. This is something that has exploded and we can make it go the other way. And I want your help to do this. Plus, by knowing all of these tips and tricks, it makes it more efficient. It takes less time to get more done. I want you to use your laser all day long. When I had my big clinic, literally, we had to put our laser appointments in bright pink. And we had to have a rule. We only had 2 lasers. So no more than 2 pinks in a row at any given time because they were that in need. So when you use your laser appropriately, it is amazing how much you will use it, right? If you get the course and you're thinking about purchasing a laser, you get discounts anywhere from 500 to 10% off of the laser, right? You go through the first part, you go, for me, this is the right laser. And then you get the discount, which is really nice. I put this picture of the eagle in because the best thing I can give you is confidence to increase your confidence to have better outcomes. All right, secret 3, the most important secret of all, treating the cartilage. Remember, chondrocytes also release the inflammatory mediators. So we can see cartilage go from nice and pretty to, okay, we've got some inflammation and we're wearing our cartilage down to, holy crap, we've got a lot of degeneration in here. Our joint capsule's thick. Remember, cartilage does not have a blood supply, right? How does it get its nutrition? From the synovial capsule. It dumps the nutrition into the synovial fluid. And then when you have load, you have negative ions come out, right? You have compression of the cartilage, negative ions come out of the matrix into the joint fluid. It grabs onto the positive ions. And then when you unload, it pulls it back in. But if you have thickened joint capsules from inflammation, you're not going to get as much nutrition. So these cells that are starting to break down will break down a lot more. Right? We have more and more changes, and then we have our osteoarthritis. Position on how to treat this is key. When we laser, we want to be aiming specifically for the cartilage. We want to be taking these guys. So again, this is what our cartilage looks like, right? We have our collagen fibrils. Type 1 collagen, mostly tendons, ligaments, bone. Type 2 is our articular cartilage. So that's these guys. And then we have our aggregans that should look like this, right? When we have fragmented, this is our inflammation. We don't have as much compression. We don't have as much motion of our ions, our nutrition to get into the cartilage. How do I do that? We talked before about coming in from the back and compressing in that popliteal fossa. We talked about scanning up and down to treat the ligaments themselves. But we can also, when we're in that place, come over and aim. So I will literally put my fingers on the other side of the joint and take my laser and come in and aim for the left side and the right side so that I can get the cartilage on the caudal aspect of that femur. Right? We're pushing the gastroc out of the way. We want that stifle to be not 100%, but mostly an extension. So we said that we want to have the limb in mostly extension when we stick our probe into the popliteal fossa. We're going to be holding here, right? Because if I'm right below the patella, I know right where that cartilage is. So I can have my laser coming in this way, and I can be treating this much of the cartilage. Now, if I have it in extension and I come in from the other side, I'm not treating very much. Getting some joint capsule, not getting a lot of cartilage. But if I flex it, check this out. If I flex the stifle, and I can flex it even more than this, I'm getting that cranial aspect of the cartilage. I have much better results because I'm getting more of the tissue I need to save. Because when he is in extension, when he is in load, where is he putting his trauma? Where is he putting his compression? Right here. And I can get that guy when he's in flexion. It's game changer. The other thing we can do, we talked about having scar tissue over here and using our patella motion to break up the scar tissue. But we can do more than that, right? When this comes in and we have the patella being tracked on the side. It thins the joint fluid. We have more groin. We have more inflammation. We want to stop that. We want to push the patella, right? So here's my fibula, right? So he's in here. I can take the patella, and if I push him medially, or I'm going to push him laterally. Let's push him laterally. Then I can aim into my trochlear groove. Can you see that angle? We can go at that angle in and treat the trochlear groove. My energy is coming in here, right? Now it's going to get some to the patella cartilage, but it's not exact. But what I can then do is while I'm holding it there, so I'm pushing this over, I can then come up underneath and get the bottom of the patella. And you're like, Laurie, what are you talking about? How can you get under the patella? I can get the trochlear groove thing. I can move it medial and treat lateral and move it lateral and treat medial. Let me show you. So here we are with the dog. Here I am. I'm pushing the patella medially, and my laser is coming in, and I'm treating into that patella groove, right? I'm coming in. Then I can push the patella medially here and come up underneath, right? Here's my groove. Here's my patella. It comes up, and then I can go to the side. I can aim up into that patella. It's much better if I have a small probe, right? These are both one diode probes. This is a Respond, this is a SpectraVet, and I can get up under there. But even if I'm using a companion or one of the ones where I have to keep scanning, I can absolutely scan in that area and then go somewhere else. And then I might even want to come back and scan again so that I can get both into the groove and under the patella. And then once I'm done pushing the patella in one direction, I'm going to push it in the other direction and hit the other side. Again, game changer. So results, I have less arthritis, less pain, less inflammation, less degeneration of the cranial cruciate ligament, so that my dogs can play and enjoy and have fun. That's what I want for all of them. Okay, Optimum laser therapy. Why did I create it? Because I have had hundreds of people say, how do I, or if I have X laser, what would my dose be? And I try to tell people that's like saying, my dog has a infection on his paw. What's the dose of antibiotic? And I say that you can't say, is it cephalexin, is it Baytril, is it amoxicillin, right? It depends upon the laser. Every laser is different, and your dosing is going to be very, very different depending upon the variables. And in the course, it goes through all of that. I've had people say, I'm not getting the same results you are. Why? Because I have more knowledge and I want to share it with you so that you can have that knowledge too. So if you like this information and you can't wait to try to use it tomorrow, you can get the course tonight. So if you want more, there's more on stifles and 25 other different body parts. OptimumPetVitality.com. You click on the courses up on top. You go to Optimum Laser Therapy. You can go in. There should be a link in the chat so that you can find it that way. Quick recap. Inflammatory mediators. We need to get the joint capsule. Super, super important. The muscle. We need to get the muscle so that we can strengthen the support structures to help that cruciate stay intact. We want it to help prevent shear force. Most important part of treating the muscle. We can do it before they have an injury, when they have an injury, and then after, right? Because we can also decrease inflammation after a surgery or after they have arthritis. So many tips and tricks. There's literally 2 whole lectures just on tips and tricks that I've learned over the 20 years of doing this. And then again, more in each specific body area. And I'll be honest, I have some things in there like, this is the exercise I would do for this, or this is the supplements I would recommend for this. Lots of really good information. Too many dogs, in my humble opinion, do okay. I don't want okay from my patients. I want optimum. Hence, optimum pet vitality, right? I want my patients to do awesome. I want you to be the people that create that awesomeness. So, bonuses. If you do it within a short amount of time, you get the indication charts, you get the record template, And you get me because I'm not just a little box. I'm not in a little box like I am tonight. I actually talk with my hands and point to things and go things with you. And you get in a community. There's 3 years of questions and answers that you can go through and you can ask your own. And we can go through things together. So win, win, win. Maximize your patient outcomes, maximize your client satisfaction, maximize your personal and staff job satisfaction. You will feel better. I promise you. And there's a guarantee if you don't like this course within 30 days, 7 days, um, it's free. You get your money back. Guarantee you like it. Maximize your revenue, right? We all have to think about our bottom line as well. So recommend signing up now. Questions. If you guys have questions, I am going to pop into the chat. If not, some people have sent questions in and we can take a look at those. Thank you. Thinking about a laser, it seems like some lasers would be easier to use when trying to treat stifles. If I'm going to be treating a lot of stifles, is there one laser that is better than another? I will go back to in the course, we go through these are the things that all of the different variables help. What do you want to help? Right? It gives you the information so that you can figure out what's the right laser for you. So now that I see that the laser can be used for even early cruciate disease, I've been using it for hip pain. I have a general practice. What are most people using their lasers for that isn't joint pain? Okay, you want a good laugh? The number one reason a client will use a laser is for anal glands. Are you using it for anal glands in your practice? Right? You should be. If you think about it, if somebody brings you their beloved pet, right? The rule in the business world right now is pets are the new kids and plants are the new pets. So they're bringing you their beloved pet, and you say, I'm going to stick my finger internally to express these anal glands, or I can laser it, and then we can probably do it externally, or we may not even have to do it, right? What are they going to choose, right? Very common. So anal glands, kidney disease, cat kidney disease, bladder disease, liver disease, GI. How long do you stay on the cartilage, joint capsule, trochlear groove before you move to the next spot? Good question, Melissa. It depends upon the laser. It depends upon the dose you need for that laser as to how long you're going to spend in there. It's all in the course. How important do you think laser is if you're treating a stifle non-surgically? Huge. It is the number one thing I would recommend modality-wise to treat these patients. And I've got one last question. I've been treating stifles, but just using the settings on the laser for that. Should I be using a different protocol? It depends upon what kind of results you're getting, right? And I will go through this. If your goal is pain, you're going to use a different set of variables than if your goal is healing, but it goes through that in the course. All right. I don't see any other questions. Have used a companion laser, Mary, at a previous practice for blocked cats and post-surgical GI surgery. Works wonders. Absolutely. I have seen laser on an intestine or a bladder in surgery that is purple. And as it's being lasered, it turns pink, right? That is wonderful. That is such a better response and less pain and better healing for these guys. Blocked cats, about 30% of the time, you don't even have to pass a catheter. And if you do have to pass a catheter, it's a lot easier because you've gotten rid of all the inflammation in the urethra, right? Absolutely. Laser is wonderful for so many different things. Thank you, everyone. Thank you, guys. I appreciate you all. We will send you a copy of this, and I will probably redo this for the people that weren't able to be with us tonight. So if there's any questions you have, you can send them to us, and we'll answer them in the second webinar. All right, guys. I hope you had fun. I hope you learned something, and I'll see you next time. Thank you, everybody, for being here. Oh, thank you, Laurie. See a cruciate patient for acupuncture and laser tomorrow. Excited to try some new laser positions. Yeah, that was my goal, is to have you guys be able to use it tomorrow. All right, guys. Have fun, and we'll see you next time.